A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. I start the CME with the name of Allah, who is very, very helpful, kind, and merciful. Me, Dr. Tariq Masood Khan, CME update by Mother and Child Survival Group of Pakistan. Dr. Tariq, an Ops-Gyne family emergency specialist internist, Gulf KSA, presently a district gynecologist. Topic for today is psychiatric disorders in pregnancy, especially post-natal depression. These mental disorders are very much important as they need to be screened out and need to be treated because they have got a lot of implications on both mother and fetus and child, and also they have got chances of relapse. As you know, this suicide is the most leading cause of maternal death in UK and has been mostly associated with the perinatal depression. So that needs to be screened out and needs to be treated, and it should not be taken lightly. The postnatal depression is a very common thing, and it is the same as it is present at other times, this postnatal depression, and it is not to be taken it should not be taken lightly, and it needs to be treated as it has got mother and fetal effects, as well as it has got implication, and it is most important, it has got suicidal ideas. So it needs to be screened by specific questionnaire, and that can be an Edinburgh depression scale and other screening questions like have you ever, the signs and symptoms could be this tearfulness, anxiety, poor sleep, and low profile, and low self-esteem. Low self-esteem, low profile, hopelessness, helplessness, and feeling of guilt, poor concentration, suicidal ideation, and lack of energy and fatigability, and lack of sleep and appetite. So loss of personal interest and loss of enjoyment in doing tasks. So with this you have to ask these specific questions like that have you ever been depressed, down, or hopeless, or have you ever been have little interest or pleasure in doing things, and the woman will respond to both these questions yes. There is very important, and also the previous history of depression and psychiatric illnesses like anxiety and anxiety disorder are very, very important. So, and there is also a period of instability perinatally and postnatally 3-4 days, and after leading to 10 days, like tearfulness, poor sleep, anxiety, and poor appetite. So these can be sorted out with reassurance, and they are self-limiting, and they will be settled with the passage of time. But as I have told you, that depression, anxiety, and psychiatric illness as schizophrenia with delusion, hallucinations, and suicidal ideation and homicidal killing, and even sometimes disinterest to their babies and lack of care also to the babies. Schizophrenia, this depression and manic depressive psychosis, anxiety, and schizophrenia. These are all very common. And for the depression, mild to moderate depression needs to be treated with self-help strategies and non-direct counseling, but moderate to severe depression has to be treated with the medication and CBT, cognitive behavior therapy. And the drugs, you should also have an idea that the drug should have been in low concentration in the breast milk, like sertraline. The postnatal depression has got a important 70% lifetime risk of presentation again with the depression, and also 23% with the in the other delivery. So it is very important to screen, and the most important thing is the increased idea of suicidal ideas or increased risk of suicide. So this is very important to sort it out, and has to be treated. And it is not like this that it just needs simply that it does not need treatment. As I told, moderate to severe depression must be treated with the medications, and the medications are antidepressants. And antidepressants, before these are, they have the you have less data available, especially the new antidepressants. But the older one, nortriptyline, sertraline, imipramine, and all these have the low concentration and have the have less anomalies and side effects. And the fluoxetine has less side effect profile in pregnancy, while paroxetine with cardiac malformation, and this, SSRI with increased pulmonary hypertension. And also the other fluoxetine and citalopram have got high concentration in the breast milk, and the others are like sertraline, paroxetine, for nortriptyline, and imipramine. They have got less concentration in the breast milk. So these has to be titrated, and it is very important that postnatal depression to be recognized, so that postnatally and after that it can be followed and easily. This is very important, as the mother can commit a suicide, not only harming herself but also the baby. Same is, and there is also, and there are bipolar effects. Sometimes manic depression. Sometimes there is depression. Sometimes there is hypomania and mania, and elevation of the excitability, overactivity, and this talkativeness. So these depression, post-depression, and all this is very important, as these are being the leading cause of death in the for the mothers, and they have got the treatment is available, and it can be followed, and it can be. So this is a brief review of the depression. We'll come with another schizophrenia and anxiety and mother-child and manic depressive psychosis. So takeaways: pray, praise, trust, love Allah, follow Rasulullah sallallahu alaihi wasallam. We must not forget our past. Allahumma ajarna minan nar, save us from the fire of Jahannam. La ilaha illallah Muhammadur Rasulullah. Kalma Tayyaba is the one which we must recite when we leave this world. It should be on our lips. La ilaha illallah Muhammadur Rasulullah. Wa kafa billahi wakila, wa kafa billahi nasira. और अल्लाहुम्मा सल्ली अला मुहम्मद व अला मुहम्मद कमा सल्लैता अला इब्राहीम व अला इब्राहीम इन्नका हमीदुम मजीद अल्लाहुम्मा बारिक अला मुहम्मद व अला मुहम्मद कमा बारकता अला इब्राहीम व अला इब्राहीम इन्नका हमीदुम मजीद. Thank you for a very patient listening. Best of luck, best wishes. Khuda Hafiz. Wama alayna illal bala.